Hi, my name is Melissa Henry.
And I'm Emily Reside, and we're both veterinary technicians at the Edison Animal Hospital.
Today we are dealing with a case of intercat aggression as a result of a new cat being introduced into the household. From the patient history, we understand that Freddie was always a calm and gentle cat until Skittles, a 6-month-old kitten, was brought home. Freddie has been outwardly aggressive towards Skittles for the past month. Alternative methods of treatment did not prove to be effective, so today we're going to be discussing the use of fluoxetine to deal with intercat aggression. Intercat aggression is a relatively common behavioral issue seen in domestic cats. It involves components of territory, fear, status, and redirected aggression. This can often be managed by understanding cat behavior. Owners should provide ample environmental enrichment within the household, use counter-conditioning techniques, use distraction techniques, and ensure all interactions between the cats are supervised until they become comfortable with each other and aggression subsides. If none of these previous methods have worked, it may be time to consider drug therapy. This is where fluoxetine comes in. Sold under the trade name Prozac, fluoxetine is an antidepressant drug that acts as a selective serotonin reuptake inhibitor in the brain. Fluoxetine is also used in humans to treat depression and anxiety. In veterinary medicine, it is used as an extra label drug to treat similar symptoms. The medication is dispensed by the clinic and comes in 10, 20, and 40 milligram oral capsules. As previously mentioned, fluoxetine can be used to treat intercat aggression. Being an antidepressant, it is also frequently used to manage urine marking, separation anxiety, and phobias. The next question is, how does this drug work? First, we have to understand what causes the aggressive behavior in order to treat it. Serotonin is a chemical messenger that transmits signals between brain cells. It has a role in the regulation of sleep, mood, and emotion. Studies have shown that low levels of serotonin in the body can lead to depression, aggression, and anxiety. Fluoxetine is a selective serotonin reuptake inhibitor, meaning that it blocks the reuptake of serotonin, allowing more of it to be available in the brain to exert its actions on the nervous system. As you can see in this image, serotonin is being released from the presynaptic nerve ending on the top and binds to receptors on the postsynaptic nerve ending on the bottom. Serotonin can get reabsorbed back into the presynaptic nerve, but what these SSRIs do is block this from happening, resulting in more serotonin available in the synapse. Side effects of this drug are rare, but they do occur. These include sedation, anorexia, nausea, constipation, among some of the other side effects listed here.
Administration is very important of this medication. It comes in capsules and is given orally. In order to administer an oral medication, you must open the cat's mouth, manually place the pill at the back of the throat, and then close the mouth and massage the throat gently to encourage swallowing. You may also administer a small amount of water using a syringe to encourage the swallowing. This medication comes in a concentration of 0.5 to 1.5 milligrams per kilogram. It is given by mouth, as mentioned before, and every 24 hours. It is important to administer this drug at the exact same time each day in order to see the full effect. Fluoxetine can be given with or without food, but when given with food, there's a greatly reduced chance of stomach upset. In order to store this medication, it must be kept at room temperature away from moisture and heat. It's also important to keep this away from children and away from animals that are not prescribed to this medication. Give this medication exactly as directed by your veterinarian. The medication is usually given once a day for several weeks. Give the exact amount prescribed and as often as directed. Occasionally, your vet may change the dose to achieve the best results, but please make sure that you do not end the treatment unless previously discussed with your vet. This medication should not be given within 14 days of administering an MAOI, which is also known as a monoamine oxidase inhibitor, another type of antidepressant anxiety drug with a different mechanism of action. It should also not be given with any other drug that could cause a likelihood of increased seizures. If you do miss a dose, give it as soon as you can. If it is time already for the next dose, then you must skip the previous dose and then go back to your normal schedule. Before starting your cat on fluoxetine, be extra careful to ensure that you disclose to your vet if your cat is diabetic, has liver issues, or a history of seizures. Breeding or currently pregnant cats should also not be taking this drug. These conditions, along with previous allergic reactions to the drug, and if they're already consuming like products, are all indicators that felines should not be taking fluoxetine. It may take 3 to 4 weeks or longer before fluoxetine takes effect. It is important to be patient and wait before returning to your vet with concerns of lack of change. However, please contact your vet immediately if your pet consumes more than the prescribed amount.